welcome to the 12th session of the New York ACP's Wisdom and Wellbeing, Making Healthcare Work Better for Physicians and Patients. I'm very happy to welcome back Dr. Didiwania for a follow-up session to her January 11th talk, Understanding Microaggressions. Dr. Didiwania is a professor of medicine and medical education at the Northwestern University Feinberg School of Medicine. She completed her medical degree at the Johns Hopkins University School of Medicine and her residency in internal medicine at the University of Chicago Hospitals. She has several leadership and educational roles at Northwestern, including Associate Vice Chair for Faculty Affairs, Director of the Readiness for Residency Program, Director of the Mentoring Program for the Division of General Internal Medicine, Site Director of the M3 Clerkship in Internal Medicine, and key clinical faculty in the Internal Medicine Residency. Clinically, she is the director of the STAR program, caring for adult survivors of childhood cancer, frequently on service as a teaching attending and an active primary care practitioner. She's here today to speak with us about individual and systemic approaches to the management of microaggressions. So thank you so much for being here again with us, Dr. Didiwania. Go ahead and take it away.
Thank you, Dr. Heinen. I really appreciate the opportunity to be with all of you again. And unfortunately, I don't remember everybody's names that are participating today. So if you were part of the discussion in January, I hope to sort of lead off from some of that. If this is an individual session, meaning you weren't able to attend the January session, I wasn't planning on reviewing too many of the definitions of microaggressions, but I can do that briefly before we sort of get into how to manage them as well. So let me make sure I am set up to do this correctly. And if for some reason you guys can't hear me or my slides aren't coming through, please do stop me either verbally or waving your hands in the Zoom window. I do have it open. I'm minimizing it a little bit. I will see you and hopefully catch on that I need to change something. So I hope this isn't on timer. Okay, so my learning objectives today are to talk about how we deal with microaggressions. So the session in January was talking about what microaggressions are and why they do really affect people negatively. And as a result of that can affect working environments. So affects the individuals, groups of individuals, and then organizations as a whole. So I do think there's something that we need to think about as physicians, both for ourselves, for our colleagues, for the people that we work with, as well as our patients. And the goal of this session is to talk about how we address them individually, and then as well as in terms of a system response to microaggressions. And then in the breakout sessions, we'll have a little bit of time to talk about our own individual responses in the past that have worked, that have not worked. Maybe some of the techniques that I talk about today can be implemented in case-based scenarios or even real life scenarios that you're willing to share in those groups. So how do we respond to microaggressions once we know what they are? And microaggressions, again, are slights. They can be usually unintentional, but they could be intentional, and they tend to be they are not intended to harm people, but they do. And they can come in the form of verbal nuances, slights that are done either by facial expressions, the way we interact with other people. The key about microaggressions is that it's not something that the person who is delivering the microaggression intends in terms of harm to another individual. And so that's the hard part about all of this, is that sometimes we're doing things based on biases that are ingrained, unconscious, and we don't realize that they're affecting how we're interacting with the world outside of us. But they affect other individuals. And if you have been on the receiving end of a microaggression and it sort of accumulates for you over time, it can affect your ability to function at work. It can lead to burnout. It can lead to anxiety. It can lead to a loss of self-worth. And so it is worth us as individuals learning how to deal with them. And I think the key thing about microaggressions is responding in the moment is often really challenging, because sometimes you have to think about you realize that the other person didn't intend for the microaggression to cause harm. So how do you draw attention or discuss something with somebody when you realize, well, they didn't really mean it. It's still causing me some sort of discomfort, but should I stop and say something? How do I stop and say something? When is the appropriate time to discuss this? And is this even the right person to discuss it with? But I feel like leaders, as leaders and educators, and by leaders, I mean anybody in the medical workforce, because we're leading our patients down a path. And we are educators, not just to residents and fellows and students, but also to our students and our colleagues. And they're teaching us and we're teaching them. And I feel that every physician is in a leadership role. And therefore, learning how to deal with microaggressions is really important. And learning how to manage them can help improve workforce contentment and longevity in the careers that we've chosen. So there's a couple of frameworks in terms of how to deal with microaggressions individually. The last slide referenced something called the interrupt framework, which I didn't talk about right at that moment. I will get into that in a moment, but I'm going to focus on this one right now. Because it depends on where you are in the triangle of the microaggression. Are you the person receiving the microaggression? Are you the bystander who's witnessed it occurring to somebody else? Or are you the source of the microaggression? And the action, assist, and arise are going to provide you a framework of how you possibly could address a microaggression depending on where on this triangle you are. So let's talk about being the recipient of a microaggression. So if somebody were to say to you, where are you from? Which is sort of the classic, easiest to understand microaggression, clearly not always meant in terms of causing harm, maybe coming from a source of curiosity or coming from trying to connect to somebody. But if you're the recipient and you happen to be somebody who has a different pigment in your skin, and you realize a lot of people ask you this question, and they're asking it to you because they realize you look different, and so they're pointing out that you look different, and that says to you, hey, this person thinks I don't belong here. They think I'm from somewhere else, and so it's causing you this reaction. The thing, if you're in the recipient stage of this, is to sort of stop and ask a clarifying question. And I think this has really helped me quite a bit. So when somebody's asked me, where are you from? If you can stop and say, well, tell me a little bit about what you mean by that. Do you mean, you know, culturally where I'm from? Do you mean where was I born? Do you mean where do I live right now? And you can say that as if you're coming from a place of curiosity, even if you have a sense of, I know this person is asking me this because they can see that my skin color is different than theirs. I would try to stop and say, well, and the reason I'm asking you that is because I'm interpreting your question in light of the fact that I've been asked this question many times before, and I may not be interpreting why you're asking it correctly. So you're coming from a place of curiosity and asking a clarifying question. And you can tell what you observed, like that, you know, in previous times, people have asked you that question because they wanted to know your cultural background and they assumed you weren't born here. And perhaps the person asking that question does mean that at the moment, but I think sort of laying that all out there allows for a conversation to occur. You can explore the impact it's having on you if you think it's the right time. So I'm not suggesting that every single one of these line items need to happen at every single instance of when you felt a microaggression, but I think it gives you the framework. And so when I say explore the impact, what I mean is you can say, you know, this may be affecting me a little bit more than you'd think this question would ask. It seems like such a benign question, but I've been asked this so many times that I now have a reaction to it. So I think being very open about what that comment or question is causing for you may help the source of the microaggression to understand a little bit where your reaction may be coming from. And you want to own your thoughts and feelings, just like I said, say, you know, it is causing a bit of a reaction to me, and the reaction is one of disappointment, anxiety, feeling like you think I don't belong. And again, you're going to have to gauge whether you think it's the right time and place to have this discussion or not, but this at least allows you to a framework in which to do that. Now, if you're the source of the microaggression and you ask the question, where are you from? And you see the other person pause, or you see a verbal or sorry, physical reaction where they sort of retreat a little bit and you realize I must have said something that isn't being received well. I don't know why. You want to maybe stop and say, okay, maybe I said something that is causing a reaction that was unintended. And you can say, I see that you're reacting to something. I'm not quite sure. I may have asked a question that I didn't intend to cause harm, but did. Acknowledge that you may not know what you've done. And so it's not necessarily acknowledging, it says acknowledge your bias, but I don't mean you should sort of clarify right from the outset, hey, I may be biased and I asked that question. I don't think that would be necessarily received well. I think it's just acknowledging that you may not understand where the reaction's coming from, but you're willing to listen. So you're seeking feedback and you're saying, okay, tell me why that reaction's happening and you know, so that we can have a more open discussion about this. And you want to say, I do think that there's something to be said for saying sorry for the reaction, not for you're not admitting wrong. What you're admitting is that somebody else had a negative reaction to something you said and that wasn't your intent. So that's it. The impact is really important, not your intent. I feel like these two columns, by the way, have really helped me in my personal relationships too, even with my spouse, not related to microaggressions. If you realize, like, it's often the impact that the comment or emotions having and not the intent of it, it goes a lot further in resolution. And then saying thank you to the other person for being vulnerable and sharing with you why they're reacting the way they are and being honest about it, because I think that also helps the conversation. If you are a bystander, you can also have an approach that you'll use because you may be the person who's witnessing the question as well as the reaction. You may not always know what the response is about, but you can also participate in opening the dialogue. So being aware that there is some sort of microaggression that's happening, responding with empathy to both sides, not just one. It's not like the person who's the source of the microaggression intended it to be harmful. So sorry, empathizing with both sides can be really important. And then allowing for that conversation to happen. And so as a bystander, it could be, you know, Dr. X, I noticed that you asked this question and, you know, Dr. Y responded this way. What was the question about? So facilitating that clarifying question, if you're the bystander, if it's not happening from either the recipient or the source. And statements that start with I think help regardless of what column you fall into, in terms of this is how I'm viewing it. And I may be wrong, but I'm viewing it this way, as opposed to saying, I see you're reacting, or I see that you said this. You could say, I perceive, you know, that this question caused some trouble, but I'm not sure. And then allowing for that education and engagement in terms of the conversation to happen is really important. So I think if you practice some of this with intent, it makes managing the microaggressions in the moment and even afterwards a little bit easier. You may not use these exact words or the exact order of this, but having this in the background saying, I just need to acknowledge that something's happening and facilitate the discussion about it can be really helpful. Sorry, let me see. Move on. Okay, so the interrupt framework is another framework that's very similar to the arise and action framework that I just mentioned. So the triangular framework that I just mentioned. The similarities are that inquiring is really the key part of dealing with a microaggression as an individual. Asking both as a recipient and a source, what is this reaction that I'm seeing that's happening in the other person? And having it be non-threatening is one of the most important things. And taking responsibility for sort of saying, okay, I am reacting. I'm reacting based on historical microaggressions that I've received. And this person may not have intended this to cause harm. So understanding that. And as a source, you could say, well, I know this may be based on a bias that I have that I'm not even aware of. And so rather than calling the other person's reaction over the top or you know, totally not equivalent to what the comment was is important to take responsibility for. And what you want to do is empower. So again, this is similar to what I was saying with the last triangular framework, but allowing everybody to take their vulnerabilities and make them a little smaller so that they can talk about how they're feeling. So empowering people to share their concerns or their feelings about what's happening. And then I'm not going to go through the rest of these because I think that the triangular framework is one of my most successful in terms of individuals responding to microaggressions. I keep hitting the wrong button. I apologize. Okay, so sometimes when you're going through your framework and you're, pause to respond to a microaggression, it doesn't get met with the kind of response that would be ideal, either from a bystander or from the source. If you were the recipient going through, like, let me sort of pause and ask inquiring questions. And I think in those situations, it's helpful to sort of take a deep breath, assume that, and really remember that offense was not the intent. You can explain how the slight was interpreted by yourself. You can ask a follow-up question. And then if it's not going very well, you have to take a step back and find other forums in which to discuss it. I don't think that swallowing it or saying, okay, sweeping it under the rug is another way to put it, or just ignoring it is going to be helpful in the long term. If you did attend the session last time in January, I shared a video about are microaggressions really harmful? And there was this YouTube video of thinking about microaggressions as mosquito bites. And if you think of each individual microaggression as a mosquito bite, any one isn't a big deal. But if you're somebody who gets bitten by mosquitoes a lot, it can be extraordinarily uncomfortable. And so I think if we just take each individual event and let it go, that can build up to cause sort of a more disruptive response later. So I do think it's helpful to, if you're not getting anywhere with the individual you're speaking to take a step back, take a deep breath, and then talk to individuals with whom you feel comfortable and whom you can share the experience with, and hopefully come to at least, if not resolution with the other person, at least you've had a forum in which to vent how you're feeling. And this speaks to that a little bit. It's, you have to think about, will further conversation with this individual be beneficial and productive? What's my current level of stress? Maybe stopping and dealing with this as an individual isn't going to be helpful for me right now, because I've had so many mosquito bites in the past, or had so many microaggressions I've had to deal with in the past, that me having to now take on the burden of stopping and educating somebody else about what they're saying or doing that's causing me harm is too much for me to deal with right now. And that's also okay. It doesn't mean you have to deal with each microaggression every single time. And it's not your job to sort of fix the rest of the world, is how I'm going to simplify that. It's really important to realize that you have to respond non-emotionally or unemotionally, because I think when emotions become a part of the response, the other person also responds emotionally, and it's really difficult to make progress in the long term in that case. So if you find yourself being emotional about what's happening, it's helpful to take a step back and address it at a different time. And I think if you're meeting resistance, I do think it's helpful to explain the cumulative effect of the occurrences to the other individual, so that they understand it's not them and them alone that's causing this response. But then you may have to take a step back and debrief with other individuals. So there's a lot of data out there about, and a lot of organizations that have spent a lot of time informing individual employees about what microaggressions are, how they should respond individually. But the data looking at response to microaggressions and whether training sessions where people learn about microaggressions and how to deal with it actually make an impact in the workplace over time. And unfortunately, it doesn't seem to make that big of an impact. There's still microaggressions occurring. I think people grumble a little bit about the sessions that they have to attend. And is it really that they're learning that much about how to practically implement some strategies to deal with microaggressions? So I still think it's helpful to know how to individually respond. I think it helps you as an individual, both if you happen to be on any side of that triangle. But the real progress can come in terms of system responses. So what can our organizations do to help microaggressions be less of a burden to any individual? So there's been a lot of system responses over time. And it's important for people in administration to be a part of the conversation on how to deal with microaggressions. I think the administrative whole needs to understand that there are practices that unfairly stigmatize people, whether it be of color, ableness, sexual orientation. You can take any form where one group feels different from another, and that our institutions often fail to take these qualities into account, and that it results in health inequities. And how does the system go about approaching that and dealing with that, as opposed to putting the burden on each individual? So you could say that organizations should recast diversity training in light of what they can actually do. So yes, they should educate and raise awareness about bias, inequality, and strategies for change, but they also may want to put into place opportunities for discussions about microaggressions. So making that part, not the individual's burden to say, okay, now I need to address this, but allowing for weekly, monthly opportunities for people to have conversations, putting in place anonymous forums in which people can say, here, I'm noticing this, X and Y is happening to me on a regular basis at work, and it's really causing me harm. So that way the organization can deal with how to address it, as opposed to putting the burden on the individual. I think one of the things that does happen in bias training is that oftentimes people who fall into the majority group, so not into the group that may feel smaller and suffer more from microaggressions, majority group often deny the inequality, and not necessarily during the training session, but outside of the training session. And that can be felt by members of the minority group. And so I think training should focus directly on addressing the defensiveness of majority group members. Why does that exist? What is it about the inequality that seems so unfair to the majority group, as opposed to just defining what the inequality is? And so I think that should be a big part of what happens during these training sessions. I think organizations should also understand that inequality is deeply embedded in the structure of our organizations. And so these structural interventions to address diversity challenges, who's hired, what the hiring process is, how we go about blinding ourselves to things that may influence or impact the biases we already have, whether it is that we remove pictures from when we're looking at residency applications, whether we blind ourselves to people's first and last names when we're going through and looking at their qualifications, whether we say, okay, we're going to make it a part of our hiring process for staff members, that it's staff members from various levels of training and backgrounds that are part of the group who review the application. So making sure that we're trying to remove bias at the highest levels so that we can impact how we're hiring, how we're treating other people. And then the organizational responsibility for diversity, equity, and inclusion goals should be something that leaders put into place. So I think if there are leaders in diversity, so having a vice chair of diversity, equity, and inclusion, or making sure that we're thinking about how marginalized groups may feel and allowing them an administrative leader to whom they can reach out is really impactful. One of the things that the system responses have done is thinking about creatinine and how we go about using normals for creatinine. And it was a group of medical students in Seattle that actually spearheaded removing race norms on creatinine. It took a long time for them to say, why are we separating based on data? There is no data that supports that normative creatinine levels are different for different races, but that was the way that the labs were reporting it. And so we need to remove that criterion from the way we report this basic chemistry panel. And so allowing for mechanisms for that to happen. There is a Mid-Ohio Pharmacy group where the hospital itself paired with community-based practices to address food insecurity that disproportionately affects people of lower socioeconomic status, and therefore people of color. And so as opposed to putting that burden on each individual physician and patient to address that, they did it at a system level so that they were providing resources to the entire organization, and that impacted that group's outcome in terms of food security. So I think if we put into practice some of these things at the organizational level, as opposed to just doing bias training or diversity training, that focuses on the individual, that can be really helpful. Here. So before we break out, and I don't know how much time I've taken more than I wanted to, but I think the biggest thing is to think about the fact that microaggressions are present in our health and education systems, and that as leaders in this system, we have to employ ways to manage them both individually and think about how our systems function. How does the place where you work both support and potentially negatively impact the presence of microaggressions, and who are the leaders within our organization then can make impactful change, and how do we engage them in this conversation? And I don't necessarily want to talk about my organization specifically, and the only reason for that is because my organization is set up slightly differently than all of yours, and everybody's workplace is slightly different. But I think thinking about what it is that we can do within our own systems is really helpful. And so I have some cases that we can do as in breakout sessions. And I think the number of participants is small enough that we could probably do, 6 or 7 in 3 groups. And then I'll float around between groups. Maybe we can talk about this for 15 or 20 minutes. And you can focus on the individual cases that I have and how an individual may respond, when an individual may respond, or what the system could have done differently to prevent this microaggression from happening, or even if the microaggression is going to happen anyway, what the system could do to help impact the impact of it, meaning, how do you deal with it afterwards? So Amanda, if you want to split everybody up into these sessions, there's 2 cases. This is one of them. We will have group leaders that can help facilitate this, but you can also talk about your own individual systems and what you've experienced both personally in terms of dealing with microaggressions, or what you've seen your system do.